Yes.
Hi, welcome to this video series. I'm Dr. Sara Sheets here today interviewing Dr. Kristie Nguyen, and welcome. How are you today?
I'm good. Thank you so much, Sarah, for having me. How are
My
you?
pleasure. I'm well, thank you. So yeah, let's just dive in. I'd love to learn a little bit more about your background, and then we can talk about your business and experience here during COVID, which I know you've been super busy.
Yes.
So where are you currently located, Dr. Nguyen?
I'm in Orlando, Florida.
All right. So, and is that where you're originally from?
No, I'm originally from Texas. I grew up in Texas most of my life. And then once I was done with undergrad, I moved to Florida to do my graduate.
Okay, so Nova.
Nova, yes.
Gotcha. Excellent. And then you just fell in love with Florida. Is that right?
I did. It was so warm and there were no more cold days except like the last couple of days. I'm like, what's going on?
Oh, is that right? Yeah. Uh-huh. Yeah, I spent 6 months of my fourth year out there at Aspen Palmer. So, you know,
Nice.
definitely loved the weather,
Yes.
the palm trees. Um, but I was personally glad to come home to the Pacific Northwest. But all right, so you're there in Orlando, and how long have you been practicing?
I've been practicing for almost 15 years.
All right. And I understand that you are in a couple different practices currently. Is that correct?
Yes. Yes. So I work for 3 different doctors as an independent contractor, and we're all currently right now we're all in basically what we call a retail setting. So within lens crafters and Targets right now.
And what has your experience been in that setting here during COVID?
It's about the same. They've actually been very cooperative with the doctors, not pushing numbers as much as they were before. So we were able to scale back a little bit to have more time to, like I said, sanitize the rooms in between patients. So they were good about that, which my worry at first is they weren't going to do that. But they made sure they provide all the necessary materials. So that way we can care for the patient, but make sure everybody's safe. So my worry was it wasn't safe to go back, but they did everything to make sure it's safe.
Sure. And in that setting, were you able then to have that continuity between the optical and the doctor's office and know that both sides were on board?
Yes.
That's important.
That's very important. So I love my staff because they do know what I prefer and I know what they prefer. So we're on mutual communication here to make sure it's beneficial to both sides. As long as they don't push me really hard, I would be more than happy to have that nice transition between my exam room to their optical for their, for the sale.
Sure. So yeah, win-win, safe. Okay. And let's see. So did you go to undergrad in Texas then too?
I did. I graduated from the University of Houston.
Okay.
Yeah, did 3 years there.
What's your mascot? Just out of curiosity.
Hang on. Cougars. I think they're the Cougars. It took a while. I was like, wait a minute. I wasn't even in sports, so.
I know. I went to University of Washington, and I do not care about sports, which is really good because I married a Duck, U of O grad. People try to taunt me. I'm like,
I married a Gator, so go Gator.
Yeah, sometimes you have to change your allegiances.
That's right.
Now, one thing I love to ask people that I'm interviewing is, what is your favorite memory or patient experience? I know that you probably have a lot in your 15 years.
If I had to pick just one, I would just pick something recent that just happened the other day. I saw a patient who was diabetic. She just came in for her routine visit, and we ended up taking retinal photos because she didn't want to get her eyes dilated, which I said, that's fine. As long as we do retinal imaging, I can still get a pretty clear view of your retina. Well, once we took the image, we saw possible papilledema at her optic nerve. So I had her go straight to the ER and get some blood work done. And the good news is she had it done so quickly, she came back later the same day with the paperwork and said, my CT came back normal and my blood pressure was good. So they told me to go home. So that was like, whew. So I mean, it's just times like that when you're like, wow, you can be that person there to save somebody from that critical situation that she wasn't even aware of. We were just concerned about her diabetes, but here comes possible papilledema at her nerves, it would have been really hard to explain to her without a visual. And good thing we had the retinal images right there. We were able to do it, showed it to her, emailed it to her so that she can show, the PCP when she went in, and as well as the ER.
Yeah, that's so valuable to have that piece of that visual evidence.
Yes, yes.
Yeah. Do you have Optos in any of your clinics?
We don't have Optos. I have the IDON, and I don't even know what the other camera is, but I don't have an Optos. Couldn't care much for that one. Yeah. I love that IDON.
And that's something though too. It seems like with COVID, having the opportunity to take a photo, whatever, or image, because it just reduces that face-to-face contact time. Sorry, I'm over here ghosting.
I think it's a great diagnostic tool, not only for that. I think once COVID is over, it's always good. I always explain to the patient, it's like going to the dentist and not getting an x-ray, but still getting a routine check. So without the photos as a baseline, like what else could we, we just need that baseline.
Yeah.
It's just so much more informative and important in any type of exams.
Yeah, you know what? I actually really like that metaphor, and I've never heard that before.
No,
I haven't.
Great ones to explain to patients all the time.
Yeah, because I would say, we're always looking for subtle changes over time, and this gives us an exact thing to, compare against. But that's a good one. Yeah.
You want to hear my glaucoma one? What I compare optic nerve to?
Absolutely. Yes. I
call it a donut. So I say, look at this, our ratios, we're looking at about a third of the size of the center to the outer. So I call it my donut. So when the donut hole is bigger, then you're at greater risk for developing glaucoma. They have picture perfect visual for that one.
Yeah, no, that's a really good one too. Someone took too big a bite out of the middle. Now I did take a quick look at your background and your other involvements, and I saw that you're involved with something called Dr. Light Medical Technology.
So what it is they're a company that develop blue light filter lamps. So you have desk lamps for like students, and you also have like magnifier lamps for like patients who have like AMD. So these are just great technology that if you don't want it in your glasses, if you don't wear glasses, you can still get the technology in like a lamp setting that you can use at home and share it with your family members. So they have different versions of these desk lamps so that you can use and purchase. And they're developed, I believe, by doctors for customers.
So interesting. So does it help with the contrast, or it's more on the?
So it claims that it has less glare and less flicker, so that the light is more stable. So a lot of time, how some of these lights, it flickers in and out, and it can cause eye strain. So what they're trying to do is eliminating all that by giving the most clear, crisp vision as possible. And they have like 3 different light settings. So you can choose between like dim, medium, or the highest contrast that they have. I can't remember how many lumens it was, but I have it in my daughter's room who have a little bit of accommodative insufficiency, and she's wearing a bifocal. So I want to make sure she has the best lighting because she's doing a lot of homework right now, being in the 6th grade. I just didn't want her to have any eye strain or headaches. So that's who is using it.
Interesting. Yeah, that's great. I mean, and anything we can do to help our low vision patients, of course.
Yeah, and they provide pamphlets and things for you so that you can educate your patients. So it's a really good company to push. Everybody's pushing the blue light glasses, but what about just these lamp sources when you have students at home? It's just so much simpler. And they, like I said, the easy pamphlets they can read, and you can hand it out to your patients. And like I said, doctors who basically partner with them, you get a commission back. So it's not like you're just recommending products, but you get a commission when your patients purchase from your recommendation. They have an exact link, they get a discount because you're recommending it, you get a commission. So it's like everybody wins.
Sure.
And getting their eyes, they're getting the best protection.
Sure. So it's like that affiliate link.
Yes.
So I assume it helps with the contrast, with strain. Are people also like coming to you with concerns about being able to sleep at night with the blue light blocking
and headaches and all that? So, I mean, all the things that people are looking for anyway. And so many people ask about blue light when they come in. So why not share this extra feature with them? Because what if they, what if they're not wearing glasses, but they're still interested? Would they get a pair of glasses with blue light only? Like I don't like putting glasses on my face if I don't have to. So if I can get it somewhere else, I would totally do that.
Sure. And that's funny because as I mentioned, I have a 2-year-old son.
Yes.
And we actually have a specialty lamp in his bedroom because when I'm reading to him at night, like I don't want him to be hyper, anything we can do to bring it down. But definitely he's not going to be someone wearing glasses. So how can we approach that from a different angle?
Exactly.
Yeah. So interesting. Okay. And so is that something where you have those in office, or you have a link where you are recommending people go to this website in order?
So again, they send me pamphlets with my link already on there with my discount code. So they can go to my direct link, or they could just put my discount code in and it'll still be, tracked to me.
Okay. So
Like
super
that.
easy. You can recommend it.
Yes.
And I'm sure that people are happy. Yes.
Super.
Now you're also involved with Optizoom.
Yes.
Tell me about that.
So with
Your third job.
I
of
know,
course.
so many. Let me count the numbers. With Optazoom is an online platform that offers optical goods to any eye care practitioner. So whether you are an optician or an office manager or an optometrist, even an ophthalmologist, if you have supplies that you purchase for the doctor side or for the optical side, they typically would have those supplies on the website. So what they're trying to do is make it convenient so you can go to just one website with the login information and just buy all your products. So, because again, a lot of times, because I don't have an office, so that's why I'm like, well, why would it benefit me? But for a lot of doctors, is they have to log into this website to buy products here. They have to log into another website to buy something else. So before you know, you're logging into 4 or 5 different websites just to place 5 orders, when you could just do it on one simple website, and it remembers what you purchased last. So that's like the first thing that pops up when you log in again. So if you need to reorder the exact same 5, you just go boop, done, and it reorders it for you. So they're just trying to me, I describe it as an Amazon of optical goods. So it's just simplify the whole process for the office.
Yeah, that sounds amazing. Now I know that you're also involved with the magazine.
Yes, a couple. Well,
Okay.
So the newest one is I'm involved in a magazine called Cookie. It stands for Cool Optometry, Optics, Kudos, Innovation, Enlightenment. So it's an Asian specific magazine out in Asia. And we have different board members from different countries so that we can all give inputs into just eye care around the world. So super excited about that. I think they just
came out with a multinational platform.
Yes.
Wow. Yeah.
So they came out with an ophthalmology one. So they did everything they did with that. So now they're doing an optometry one. So
what's your involvement with that as far as contributions? Are you, writing articles? Are you interacting with members? Are you?
So what my job as an advisory board member is to give ideas for topics, as well as I could write an article if I wanted to. So for the first issue, I did write an article just introducing myself. Which was simple. So after that, like I said, for the second issue, they were just asking like, what topics should they discuss, or they have ideas and say, well, can you contribute to any of these topics that we may discuss within the magazine? So I'm just leading a voice, but I don't have to do a lot of the editing or the back work of it.
Sure. And what are the upcoming topics? I'm sure that COVID is going to be on the top of the list.
I think myopia control is up there on the top of the list of things that they were wanting to discuss, how it's different between the different countries and how it may be getting worse here in the US versus Asia, because Asia is always, to them, it's like a pandemic. But like, how do we treat it? Do we all treat it the same? Do we treat it differently? So they have, they're trying to get different doctors to add input to that topic. But they do have a lot of different topics, and it's free. You just go to the link. I think I did post a link for the first article when it first came out, but we don't have the second article yet, because that's doing the woodworks.
Well, I'd love to get the link so I can share that too. And then of course, as a fellow female interested in skincare, I know that you have some involvements with that side of your world too. So I'd love to hear about that.
So I am an independent contractor, or independent contractor with a consultant with Rodan and Fields. So that's the same doctors who created Proactive. And I've been with them for almost 4 years come January. So I've been doing that. And that's what got me involved in social media. And literally that's what opened up all these other doors in optometry for me, because of my social media presence. But it's just a great way to, your face is right there next to your eyeballs. So I think it's great to transition right into that if somebody was interested in terms of a patient. But for myself, for me, it was a self-confidence thing for not having to worry about caking on a whole bunch of makeup. So this is my face that I did this morning at 6 o'clock in the morning after I ran 2.2 miles with my husband. I haven't touched it up at all other than lip gloss. So like I said, it just helps me feel confident that I could just do whatever I do and my skin still looks pretty good.
Absolutely. Yeah. And I'm sure you get compliments even over the mask. I read some quote the other day or tweet, I guess. I read a tweet. It was like, I'm ready for people to start carding me again at the liquor store instead of just analyzing my fine lines over my mask.
Right? Because even if you wear the mask, your eyes are still showing. So why you don't want like wrinkles around your eyes or your forehead right here where everybody can see it. And my lashes and brows, that has to be like top game there. So we have all these different products for all those, things. But yeah, I would get carded all the time. And I'm like, card me all you want.
Have at it. Absolutely.
I know. I'm like, absolutely. Here's my card. Card me. So I love it.
So would you have one piece of advice for the busy optometrist who is like you, interested in, motivated to be building their own business as well as their patient base, and then of course serving during these very trying times?
So my advice would be you just have to start branding yourself in social media. I mean, that is just where it's going. Our patients want easy access to products, to healthcare. They're looking for it online. So if you do not have a Google business page, you need to start one. If you are not active on some of these different platforms to advertise and brand yourself, you need to get on out there because somebody else is already doing it. And as they're growing themselves, the patient's going to go to them because that's the first person that's going to come to mind if they have an issue. I have people reach out to me on LinkedIn all the time asking for my advice on things, which again, you shouldn't really give people advice like that over. But again, as long as it's not very specific and general information, I think that's still good that they do reach out to me as somebody in the field that they have trust in. So for my advice is, like I said, always start branding yourself. I mean, you're branding yourself no matter what, but
Sure.
you have to be more selective and intentional of how you brand yourself so that you can be a more positive influence that people want to gravitate to and go to when they need advice.
Right. So building your authority.
Mm-hmm.
Yeah, in your local community. Yeah, that's huge. Absolutely. Yeah.
Yes.
Well, thank you so much for sharing everything today. Really appreciate it. And again, I'll ping you for those links so that I can share those. And I'm sure that people can also reach out to you if they have any questions. And yeah, hopefully we can help more people see more comfortably and be more vibrant. So, all right. Well, thank you, Kristie.
You're welcome. Thank you, Sarah.